talking health this morning. We've talked about the health of the nation's economy, but let's talk about your health. The focus is on cholera. And this started months ago, actually. There were reports in some parts of the country. Then it hit Lagos, and people just woke up and thought, wait a minute, if this can happen in Lagos, what about other states? And then we start seeing cases. You just heard from Ebonyi official now speaking about the cases in Ebonyi State. So we're approaching the peak period of cholera. So the NCDC, they do like projections, and this is usually the peak period. So what do you have to do to ensure that you, your family members, those around you are protected? Well, that's the conversation we're having with Dr. Shalamuni, who's a public health physician and MD, Mayor of Primary Health Center. You're welcome to the morning brief.
Thank you very much.
Well, it's good for us to see, public health centers making a showing, because that is the lifeblood of health in Nigeria.
Right.
So we'll talk about that, the role of public health centers in preventing cholera, treatment, and the general health situation of the country. But I want to quickly draw an inference from the cholera situation in Lagos and how Lagos was able to handle it, because there are other states now, they're probably dealing with these issues.
Exactly.
First, they don't even know because nobody's testing. They just hear deaths, and people die, they're buried, and they move on, and just see that people keep dying. So in terms of even tracking these cases, testing and ensuring that they are dealt with appropriately. So maybe we can borrow from the Lagos case and then extrapolate, particularly in the area of prevention and treatment. Because as of July, this was a major concern in Lagos. People were scared.
Exactly.
But it looks like it has tapered down. So what exactly happened?
The first thing you want to look at is that Lagos has a structure for surveillance, for treatment, for management of outbreaks. And that structure has been, treated well, serviced well, maintained over the years. We coming from back of Ebola to COVID-19. Lagos was the epicenter of COVID-19. But you could see that we were able to curtail COVID-19 such that the mortality came down. So the same thing also panned out with cholera. So we have a structure for surveillance. And when I say structure for surveillance, talking about right from the grassroots. When an index case takes place in Lagos State, or when an outbreak takes place in Lagos State, there are already surveillance officers, there are trackers who get to follow these people up. There are centers where individuals who have this illness can come to and register their complaints. And there are people who will line list you and follow you up. They don't pay lip service to surveillance and tracking of outbreaks in Lagos State. No, it's done real because I've been part of it. So you line list, you look at the index case. The index case is curtailed. For example, if the person reports, into a private facility, all the private facilities in Lagos State already have a connection with the government facilities at the grassroots. So, and there's not case definition. So when an outbreak enters a facility in Lagos, either private or whatever it is, and there is a definition of that index case, the experts on duty call the grassroots level, which is the primary center. They have designated number to call, and from there, the cases are curtailed, samples are taken, line listings are done, families and relatives of those individuals are visited. Even while those individuals are in the hospital, their families are visited. So that takes place, and it gets us out of this.
So while it's interesting to hear the work being done by the authorities, and I really hope that this has been replicated across the states, but what you hear is some of the states have just buildings. They don't have manpower, equipment.
Exactly.
And these challenges are there. But I want to speak to Nigerians now, the people who will present eventually, hopefully not, because this program is meant to help them prevent this from happening. What are you telling people regarding prevention? Just looking at the NCDC's Twitter handle, for example, you see that a few hours ago, they talked about cholera. In fact, that's, I think, their latest tweet. Stop cholera. Symptoms: sudden severe diarrhea, nausea, vomiting, fever. Now, these are symptoms that people have from time to time, and it's not really cholera. So where does prevention really start from? So I want us to start from the starting point, then we can now build it up. So where does preventing cholera for everyday person, where does it start from right now?
All right. So I want to categorize these things, when it comes to cholera prevention in terms of geographical location, the individual themselves, then the health sector, the health facility, health workers, then we have government. So talking about the geographical, we want Nigerians to be aware that cholera outbreaks are common during rainy season. April to September, we just got into October now. So we have the rainy season ongoing, in major parts of Nigeria. So expect the water bodies, the rain to wash certain contaminated, soil or whatever, what have you, to the surface where people depend on water. So there's a lot of contamination ongoing as a result of that. So people need to be aware of that, first of all. Then number two, we also need to take cognizance that cholera comes as a result of contaminated water, largely as a result of water. So the water you drink, how potable is your water that you're drinking? What's the source of water drinking on a day-to-day basis as an individual? So the source of water, is it boiled? You may not have these funds to afford the bottled water. What about boiling your water at home and taking a quantity to your place of work, and not leaving it to chances? So that's very important. Number two, washing your hands regularly before you handle food, after food, use the restroom. You must wash your hand even before you touch a food or anything or eat. So you must wash your hand regularly. Very important. Then number three, what is your waste disposal? How is it like, in your office, at home? Many of us right now doing cutting corners. You dispose your refuse, in open places. Defecate in open spaces. So these are things that will not help us, as an individual. So you also have to look at that too. Then when you buy your food, because talking about food hygiene in the market, maybe you bought fruits. You need to wash them properly before you start eating them. Then if there are things that needs to be cooked, you need to cook properly. We know the economics is a bit hard on Nigerians now, but then you must look at all of these things to help you, to be able to prevent cholera on a day-to-day basis. So these are things then also your health-seeking behavior. Once you notice diarrhea, then you don't assume. You must go to the nearest hospital close to you and report. And the doctors there or the medical health workers there can look at all of that, and say, okay, yes, this is likely a suspected case of cholera or not. So that's also important. Your health-seeking behavior as an individual also must improve if you want to really prevent cholera, as a day-to-day lifestyle as a Nigerian.
And we hope that those lifestyle tips, have been internalized, and Nigerians will begin to adjust, because the cases are real.
Yeah, really.
In Ebonyi State, we hear that the death toll has reached 13, and in one other state, we hear that there are suspected cases. Yes, in Oyo as well.
Yes.
But I'd like you to speak to prevention at the level of government, because in June, when the cholera cases peaked, the NCDC government activated an emergency response center, to deal with cholera outbreak, and it was to the effect that they will be supporting states, to tackle cholera with the provision of laboratories, test kits in all the states of the Federation. So don't you think, Doctor, that from that time up until now, we ought to have witnessed a reduction rather than a spike in cases? So at what point has the ball been dropped, either by the promised support in the emergency activation by NCDC or states of the Federation in terms of provision of infrastructure? Because are we really supposed to be talking about deaths at this point?
At this point, it's very unfortunate, to be having deaths from cholera, especially in Nigeria, where we're looking at developing, and becoming one of the global powers. So it's unfortunate, because you look at cholera, it's death from poor sanitation. So why we are going to grappling with poor sanitation in 2024? Where did we draw the ball? Well, the government support actually came, because I can remember that a lot of rapid test kits, were supplied to facilities. So I think states now need to take responsibility, because the NCDC actually did step in, because they have a budget that is running, and the kits were provided. But then these where states need to take responsibility for infrastructures. The federal government will not help you to a certain level, which you have helped yourself as a state. Where are the infrastructures? Where are the personnel? Where is the technical know-how? Of all these individuals. These are important, because we're talking about cholera. Where are the the staff, to collect the sample? Where is the preservative medium for the sample? Where is the communication? So some areas, where you pick sample before you get a feedback, it takes days, weeks, due to distance, due to logistics and all of that. So, states, need to budget for all these things, and make them available so that, the treatment of cholera, the management of cholera, can be top notch in those states. So another area where governments need to play a good role is in the aspect of policy. Policy implementation is very important. We have so many agencies against environmental pollution and all of that, but how many people are we really, bringing to book? How effective is that policy, in our different states? So that one also needs to, come up, because people are dropping ball. They are losing, that sense of, prevention, that collective prevention that will help, every Nigerian. So like open defecation and refuse disposal, how many homes, offices, have been shut down because of that. Lagos State is doing a great job as far as environmental, pollution is concerned, and also good housing is concerned. But then we look at other areas, other states also. How well are they doing all of this? So this is where I think government needs to, to do well. But NCDC have actually played their role, made the kits available. Though these kits, can be more readily available in all these centers. But then the state also needs to rise up. There's a budget for health. You must make your budget for health to work for you in the state. So I think the government has a role, to play there, and to make sure that even with the ad hoc staff that can be employed, temporarily, train them for a period of time, on how to diagnose this case, or how to track this case, or do surveillance, active surveillance, and also do the testing, transfer the samples, make sure that the end users, they get their results, and then provide isolation centers where cases can be managed to prevent, spread.
We need more evidence just to attest to the fact that indeed the NCDC has provided the kits and the equipment in all 774 local government areas of the country.
Agreed.
And I say this because some of the pictures coming in from some of the PHCs in certain states, show some deficit in terms of manpower and what they require to tackle the cases. But Doctor, I want you to now speak to Nigerians about what to do in the case of an emergency, because there are reports that, when there's a suspected case of cholera and it progresses, it kills very fast. So what can first responders do to save someone who has a suspected case of cholera?
Okay, all right, so let me start with the individual. Noticing watery diarrhea, the first thing is rehydration. You must rehydrate yourself. That's very important, because what kills very fast in cholera is dehydration. So salt sugar solution, you must start that salt sugar solution as an individual. We have them in sachet forms, so you can get that and start taking that first of all as an individual. Very important. That's one. Number two, go to the hospital, preferably government hospital near you, or a private hospital, closer to you, because depending on the location and distance and availability of government hospital. So go to an hospital near to you and complain, about your symptoms on time. Don't do self-medication. Don't get drugs over the counter. Don't put yourself as okay, just okay, maybe because I took something, my tummy is just reacting. No, just report, because we are in the midst of an outbreak. So you need to get to hospital and report to an health worker. Some government hospitals or some hospitals do not have a medical doctor, in some parts of the country. So, but let's see an health worker and explain that this is what you're having. And from there, the surveillance system in that local government will be activated on your behalf. There's the NCDC, emergency number to call. There's also at that local level, there is a degree of disease notification that's ongoing, at the local level. So from there, a sample will be taken, you'll be isolated, sample will be taken, then you can begin to get rehydrated right on immediately when you see an health worker, in a government facility or in a private facility. So these are things you need to do immediately, when you notice that there's a water diarrhea, you don't give it a chance. Also, your family members too, you want to isolate yourself away from the family members. You don't want to share things with them at that moment, right. And you also want to turn them in, for testing also immediately. These are things you can do, because there could be a continuous spread, from that. There could be a reinfection also. So these are things you need to do for you to combat once you know that there's a watery diarrhea.
What concerns me most times when we talk about these things is we already have a challenged health sector. right? If you see the images of some primary healthcare centers,
that's right.
These places don't even deserve to be called dilapidated buildings. They don't deserve to be called abandoned buildings. Talk more of a place that people should come and get healthcare. And we can talk about manpower there, the equipment. You most likely come down with another illness in some of these centers. You went for something else, but you may live with an extra illness. So it's really concerning that we now have extra issues to deal with, and we've not even fixed some of these healthcare centers. But I'd like you to end on this note. I want you to paint the picture in a much more glaring manner. I don't know if your health centers had to deal with a cholera case. If you've had to, maybe you can tell us what the experience was like. And there's a tendency for people to think, it will not happen to me, right? I stay in this area, right? And I'm not even a poor person in that sense. So if have you had to deal with a cholera case? What was the demography of the person or the people like in terms of age? You can talk the sex, the social status, and all of that. So people understand that these things are real, and they begin to know that, hey, maybe it can happen to anyone if you're not careful.
Away from what has been, that cholera is a disease of under 5 children and all of that. Actually, the initial cases we were grappling with in the facility had to do with the elderly, the adults, the middle age, working class. The social status is there. Not just the lower social. No, the middle socioeconomic class. The guy was involved in a party and all of that, and from there travel all the way down to a guy travels on Monday, comes back on Friday to the family and all of that. So keep coming back home on weekends and discover all of this. So it has nothing to do with children only. Yes, children under 5 are susceptible, but then adults, middle age, it can affect any age group. So, and not only that, not just for the poor. No, it can affect but the rich also. You can go to a center whereby the preparation of the food or the groceries were not top notch, and this thing happens. So we want to tell Nigerians, Lagosians, to please, cholera can affect any age group irrespective of socioeconomic status. That's one. 2, in terms of the clear picture, at the facility where at my own facility, we have, like I said, we have a good surveillance system. So the individual walked in, and due to interaction with the doctor will look at this is likely to be a cholera case. So the patient was put in a waiting area, an isolated area. Then rehydration started right away, intravenous fluid, and then the disease surveillance officers came around, laboratory involved in that facility took samples using their garments, preventive garments, and also through their infection prevention protocols, to take the sample.
I hope the person survived.
Survive.
That's cheery news. We've seen a lot of deaths, but
then, like you said, there are several government facilities across the nation, that in a sorry case. Government needs to do a lot.
Absolutely.
Utilize the basic care provision fund right now that is ongoing, to build, to fix your challenges in terms of infrastructure, in terms of manpower, and you go there.
You've had some facilities that it's Doctors Without Borders providing healthcare services, and they're not at war.
They are not, exactly.
You see MSF in places where there's war, but these places are not at war. They're enjoying peace.
Exactly.
But the people servicing the healthcare centers are Doctors Without Borders. Well, Dr. Shalamoni, we have to thank you so much. Thank you for the work. We wish you the very best, and we do hope that everybody's able to wake up to their responsibilities. Dr. Shalamoni is a public health physician and MD, Mayor of Primary Health Center. Thank you once again.
It's a privilege. Thank you very much.
Well, we'll take a moment now. When we return, we'll turn our attention to the big screens. Oh, yes. Nigeria has been doing amazing things, box office streaming platforms, and we'll single out one of these amazing works. It's an epic. Oh, yes, this conversation will be epic as well. Stay with us.